It is something that the
Oh.
So today I'm going to be making a video about Hi guys, my name is Professor Ajiboye and this is my second video. I supposed to already make a video way back. See, like as much as submitted my second video way back, but then I had like issues with my phone and classes and everything. I was going like, yo, Merry Christmas to you guys. I'm making this video a day after Christmas, so I'm trying to say Merry Christmas to you all. I hope this meets you well and your family members and everyone around you. So yeah guys, and then I thought about making a video about egg transplant, because this girl just like got a cool doctor and she had like no knowledge about it, and obviously it's a lifestyle for girls, right? Because when you go on TikTok and all other apps, you see girls coming on there and saying egg transplants for 200,000 naira, and they do not even have like an idea about what it is all about. They just think it is just to extract their eggs and they get paid for it. They do not know that there are like consequences for it, and then they do not know that there are some things that need to be known and things that need to be done before. So guys, as I was saying about the egg transplantation thing and about the girl that didn't know about it, and I'm trying to just talk about it to everyone so we can all have like an idea of what it is all about, and we won't fall into the hands of people that just come online and they just go on platforms, on social media platforms, and then they just come and then entice girls of her ages to come around and donate their eggs to women who are like well knowledge and they know a lot about egg transplantation, and then they just use that like one huge amount of money. It's not even huge, men thinking about it, but then I think we all know how the country is, and we can all testify that okay, that money can like do a lot of things. They just tell you that, oh, because you're on your period, instead of you to have like period pains and all of that, you can just like donate your eggs in order for you not to have period pains, which is a freaking lie. Like, why would you like, okay, yeah, it's kind of like true, but then they won't tell you that there are like things you shouldn't do and things you can do. Do you get what I'm saying? You donate your eggs while you're on your period, because that is when the woman eggs, like the woman, sorry, not woman, the woman eggs fertilizes, and then then we produce the eggs out during our period, during our menstrual cycle. So these people just come on social medias and then they just kind of like tell us that, oh, you can do this thing, you can do that thing, and you get paid for it. Like, they do not go deep into telling you what it is all about. So egg transplantation or egg transplant, it is when a woman's egg is being extracted from her womb. I think we all get that. Like, a woman's egg will be extracted, and then sometimes it is taken into like another woman's womb, like someone that her egg cannot germinate or fertilize. Not like fertilize in the sense that the woman won't have her period still. She can. It's mostly used for people with is it PMS? It is mostly used for women who do not like have like regular periods. They have like irregular period cycle, menstrual cycle, sorry. They have irregular menstrual cycle and all of that, because they do not know when they are going to like be on their period, or when they are going to start ovulating, so they can be able to calculate when they can get pregnant and when they cannot get pregnant. So mostly egg transplantation is just done to help those women. It's kind of like a nice thing, honestly speaking, to help people who want to bring forth children into the world. And so women that cannot that their eggs cannot germinate or fertilize, then they just transplant egg, then they buy eggs from people who feel their eggs are like are well okay to do that kind of thing, and then they get the eggs. Sometimes they transplant it to the woman. That's why we call it egg transplant, really. Then they just like put it to the woman's womb, or they had like sperm into it, and then they, you know what I mean, like when a woman and a man get together and they give birth. So instead of doing that in like the normal way it is done, then it will be done in a way at least the woman's egg and like the egg of the person which you had gotten the egg from, and probably your husband or something. If you do not want your husband, you can just like get a sperm donor also, which is also done, and it's okay, yeah, it's legal for anyone that wants to do it. Then you get a sperm donor, and the egg that has been transplanted from the lady and then the man, the sperm donor or your husband, will be paired together, and that's how it is. That's just what it is all about, for the woman to be able to get her egg. The process of getting the egg from the other lady, like the egg transplant, is just known as egg retrieval. That is, you're trying to get the egg from the other lady. Some people, it might not be due to the fact that they have irregular menstrual periods. Some people might just be age. You know, a woman has a period in her life where she won't be able to give birth with time. Some people might have their periods right from ages 9 to 50, and they would never be able to give birth. So they are then they just get a egg donor to help them with it. So yeah, it's not basically everyone that they have irregular menstrual periods that always try to get egg from people or buy eggs from people. So the things that are meant to be known that these people or these hospitals do not tell ladies about are just that you go for medical evaluation. For your medical evaluation, you'll be tested thoroughly. Both the egg donor and the recipient of the egg, they will both be tested thoroughly to make sure that they are both suitable for the condition or the procedure in which they are about to go through. Because egg donation is not just a thing of you just sleeping, the doctor removing your head. It is a medical or surgical process. So for it to be done, both the recipient and the egg donor will both be tested, and if it is well, like if it had gone through like medical tests and it has been observed to be something that is nice, then obviously both the recipient and the egg donor will both be tested, and then they counsel them, because they need psychological counseling. For the case of this girl that I said was being tricked, she might not be counseled. Obviously she wasn't counseled about it, but because if it was to be that she was told about it and she had like a huge knowledge about what she was being taught, about what she wanted to go through, rather, she might have even said she doesn't want to do it, honestly speaking. She might have even said she doesn't want to do it, honestly speaking, because a lot of people, when being told that okay, this is what you want to go through just for 200,000 naira, 500,000 naira, basically egg donation is based on the person, based on the recipient. The recipient might be willing to go for 2 million naira. So if you are being told that oh, you are going for this thing for just 200,000 naira, she might not want to do it, honestly speaking. So obviously she was not counseled and she was not told about it. She was just told that you have to just donate your head and help another woman to bring forth into the health. So they need counseling, then hormonal treatment. Sorry, the recipients will have to like go through hormonal treatment in order for the uterus to be able to like accept the egg. Do you get what I'm saying? They take estrogen to thicken the uterine lining, and then the uterine lining is what sheds during your menstrual cycle. So for the recipient to be able to like take in the egg that is being donated, the recipient has to like go through hormonal treatment where our uterus and everything will be cleaned and all of that. So that's just for the recipient. Then the retrieval I'm sorry please, then the egg donor would also be treated just the same way the recipient has been treated, so that the recipient will be able to produce multiple eggs. Not the recipient, so that the donor will be able to produce multiple eggs. Then they are also treated as well, while the donor is also treated. Then they go through legal agreement. So as for the recipient, nothing to happen to the recipient, and then they'll be able to be told that, oh yeah, you already signed it down that you are doing this thing. Like you had like a huge knowledge about this thing before you just went through it and all of that. It wasn't done under duress. You weren't told to do it just because of money or something like that. Then they have like a legal agreement between them. Then they have the logistic planning, where they talk about the movement of the donor and the way the hair will be transplanted, because sometimes the recipient might not be in the same place where the donor is. So they talk about logistics of how the egg would reach the recipient. Then both the donor and the recipient, they both need support from their families and friends and their loved ones. Your family and friends of both the donor and the recipient must know about it, so that this thing would be known. Whatever happens to like the donor, the family members will be able to like come around and rally around the egg donor and take care of the egg donor. And then there are consequences to this thing when you don't know about it. We have the surgical risk. For the surgical risk, it can lead to bleeding, infection, or even damage organs surrounding your uterus, or it might even damage some people's uterus. Like that girl that I talked about that I saw on TikTok, her parents said she bled for at least 5 months. She was just bleeding, and it wasn't bleeding like a normal bleeding, or when we talk about bleeding of women who are who are on their menstrual cycle and then they bleed and bleed and bleed for 8 days or something. No, she bled for 5 months or more, and it was like a bleeding where she had to like use a sanitary pad at least in an hour or 2 hours. She had to like change her sanitary pad. That was how crazy it was. That was because she had gone through it in a good manner. If it had been done in like in the right sense in which it was supposed to be done, it might not have been like that. So her uterus was damaged, her womb is damaged already, basically because she wasn't given like a prior knowledge, or she wasn't well counseled about how egg donation is all about. Then we have the emotional consequences also. We have stress and anxiety, we have attachment issues. Some people will feel like, oh, it's my egg, she's my daughter, or is my son, like the egg when it germinates and becomes a baby. Then they start thinking that, oh, that's their child also. So then some people would or might want that child back for themselves, which is not right, because you already signed a legal agreement. But basically because they were not well counseled and they do not know that, oh, this thing is not right, you are donating your hair for the money and it's just the money alone, they would need to know about it, that, oh, they are not supposed to do something like that. So guys, and then it can lead to like legal issues, honestly speaking, because some people will start like it might lead to issues where they have to like call in their parental rights, and especially when the egg donors are used, when the egg donors do not even know about it, and then they start fighting over parental rights and all of that, which is what I'm saying. And then I'm just trying to tell ladies out there that if you do not know about it, just don't try it. And use the social media. Like, that is why we have it. Like, that is why we have Google, we have AI, we have everything, just to teach us and give us more insight about whatever we are doing. Do you understand what I'm saying? So we all have to like make sure we once we just know that we want to do something, we should try and make insights and check like make researches about everything, so as for us not to go through emotional pain and all of that. Bye guys, I love you so much. I'm sure I had like a boring time, like you had a boring time with me, but then I'm sorry, but then we just have to like talk about this thing because they are not well talked about enough.